Melbourne is the COVID capital of Australia. We've got schools closed, businesses are on their knees, and the populace is at the mercy of an inept government advised by inept bureaucrats. But the public servants locking down Victoria are not having their livelihoods destroyed. They take no pay cuts during lockdowns. Indeed, during last year's lockdowns in Victoria, public servants were paid $669 million more, while the earnings of those in the private sector dropped by $3.5 billion. That equates to the average private sector worker receiving a $1,255 pay cut, while the average public sector worker got a $1,574 pay increase over a 6-month period. This is according to analysis by the IPA of the Australian Bureau of Statistics compensation data. We were never in this together. And that is crystal clear as Victorians suffer through another lockdown that is costing us $2.5 billion a week, according to the Australian Industry Group. Victoria's lockdown again, despite extensive testing showing only single-digit cases. Thousands and thousands of close contacts of those infected with this beastly strain have been tested, and yet we have single-digit cases daily. It was 4 today, 3 yesterday, a total of 7 out of more than 100,000 tests. Right now, the fortunes of an entire state rest with the competence and judgment of health bureaucrats. We've heard Victorian Chief Health Officer Brett Sutton and COVID-19 testing commander Jeroen Weimer use inflammatory, scaremongering language to describe the variant behind Victoria's latest outbreak. But leading infectious diseases experts have come out to dispute their claims. They say there is no evidence that this variant is moving faster than other variants or spreading in new and unexpected ways. University of Melbourne Professor James McCaw, an infectious diseases expert who is among a team who advises the National Cabinet, said the claims were not supported by the data. He not only said there was no evidence, but cautioned against inaccurate scaremongering. He said, "I don't think it is helpful to seed alarmist or doomsday-type thoughts into the community." He was not alone. Other leading infectious diseases experts, including Professors Greg Dorr, Peter Collignon, Catherine Bennett, have also debunked or disputed the claims made by the Victorian health bureaucracy about the latest outbreak. But that has not seen a change in the rhetoric. Here is an exchange from today's press conference.
With all due respect, where is the hard evidence that these are fleeting cases, or are we just basing this off what someone has said?
Well, we're basically off the fact that we've got 8 examples of people getting positive coronavirus infections at 5 locations from people that they don't know.
Is that a new thing?
Yeah, that is a new thing. That is a new thing.
People are getting COVID from strangers.
No, the people are getting COVID at this scale in these kind of outbreaks. They're not getting it from household contacts. They're not getting it from their partners.
We've
they're not getting
seen
it from their
stranger-to-stranger transmission before. This isn't a new thing.
So if we go back to Holiday Inn, we did not see this intensity proportionally of stranger-to-stranger transmissions. If we go to Black Rock, we didn't see it. If we go back to Shepparton, we didn't see it. If we go back to Kilmore, we didn't see it.
There were a lot more mystery cases back then, to be fair. There was a lot that we didn't know.
Not in the case of Holiday Inn. UK variant, again, we're the only place to run the UK variant down to ground.
The only place to run the UK strain down to the ground, wasn't the case in Queensland earlier this year confirmed as the UK strain? Of course it was. These people must think we're all suffering from collective amnesia. We're also told today that a new COVID variant has been discovered in Victoria, the Delta strain. Again, there was a suggestion that this presents new challenges we haven't encountered in this country before, but the barbecue man in New South Wales had the Delta strain, and they managed to contact trace and contain the outbreak without locking down an entire city or state. New South Wales has shown again and again that there is a better way, a less destructive way to manage this crisis. Victoria's lockdown mentality has devastated countless lives and livelihoods. Children too have paid an enormous price, missing out on months and months of schooling. And the mental health of so many Victorians has been negatively impacted. Last night, we found out 2 of these so-called fleeting transmissions, these cases that were used to justify Victoria's extended lockdown, were in fact false positives. But that doesn't mean this inept government will reopen the state. Throughout this crisis, they have shown an unwillingness to adapt and to follow the superior New South Wales standard. The Vic government love to play the blame game, but they cannot get the most basic elements right. They not only stuffed up hotel quarantine last year, but also contact tracing. We've had the QR code fiasco, which was only resolved last week. And they still cannot provide an online booking system for their vaccination centres. Victorians deserve better. Let's hope they remember that next time they go to the polls.